1 in 3 adults over 60 in the United States either has diabetes or is pre-diabetic, and over 90 million of them have no idea, not because diabetes is invisible, but because the early warning signs appear in a place most people never think to look: their feet. The feet are the body's earliest and most reliable warning system for diabetes. Before your blood sugar becomes abnormal enough to trigger a diagnosis, before you feel any obvious symptoms anywhere else in your body, before your doctor has any numbers to act on, your feet are already showing the damage, quietly, gradually, in 9 specific ways that are almost universally ignored until the damage has been building for years. Undiagnosed diabetes is not a minor oversight. It is a condition that is silently damaging your nerves, your blood vessels, your kidneys, and your vision every single day that it goes undetected. And for seniors over 60, the window for catching it early and reversing the damage is narrower than it is for younger adults. Every month of delayed diagnosis matters. My name is Dr. Michael Kent. I have spent over 20 years in medicine focused on senior health. And today I am going to show you 9 specific warning signs in your feet that can appear months or even years before a formal diabetes diagnosis, what each one means, how serious each one is, and what you need to do the moment you recognize any of them. Check your feet while you watch this video, because one of these 9 signs may already be there, and knowing it today could change everything about what happens next. Before we go through these 9 signs, if you are not yet subscribed to this channel, please take 2 seconds right now and hit that subscribe button and tap the bell icon. Every week I post senior health videos that give you the kind of honest, detailed information that can genuinely make a difference in your health. You do not want to miss what is coming. Subscribe now, then let us get into these 9 warning signs together. Let me start by explaining why the feet specifically are the first place diabetes shows up. Because once you understand the mechanism, every single warning sign I am about to describe will make complete and immediate sense. Diabetes causes 2 kinds of damage throughout the body: nerve damage, which doctors call peripheral neuropathy, and blood vessel damage, which causes poor circulation and reduced oxygen delivery to tissues. Both of these processes happen everywhere in the body, but they show up in the feet first for a very specific reason. Your feet contain the longest peripheral nerves in your entire body. The nerves that run from your spinal cord all the way down your legs and into your toes travel a distance that no other nerve in the body matches. And the longer a nerve is, the more metabolically demanding it is to maintain, and the more vulnerable it becomes when the fuel and oxygen supply is compromised by elevated blood sugar. At the same time, the blood vessels supplying your feet are the smallest and the most distal in your circulatory system. They are furthest from the heart. They receive the lowest pressure. They are the first to show the structural damage that high blood sugar causes to blood vessel walls, thickening, stiffening, and narrowing that reduces blood flow to the tissues they serve. The result is that the feet become a kind of early warning display, showing the effects of diabetic nerve and vascular damage months and years before those same effects become apparent in larger, more central, more resilient structures. Now let us go through all 9 warning signs. Warning sign number 1 is persistent numbness or tingling in the feet and toes. This is the most common and earliest symptom of diabetic peripheral neuropathy. The sensation is typically described as pins and needles, similar to the feeling when a foot falls asleep, but without having been in an awkward position and without it going away after a few minutes. It tends to be worse at night when you are lying still, and it typically starts in the toes before gradually spreading to involve more of the foot and lower leg. The mechanism is direct nerve fiber damage caused by elevated blood sugar. Glucose in high concentrations is toxic to the myelin sheath, the protective coating around nerve fibers that allows signals to travel efficiently. As myelin degrades, signal transmission becomes erratic, producing the abnormal sensations of tingling and numbness rather than the clean, accurate sensory information a healthy nerve would transmit. If you are experiencing persistent tingling or numbness in your feet that has been present for more than a few weeks, this warrants a blood sugar evaluation. Do not dismiss it as aging or poor circulation alone. Warning sign number 2 is a burning or hypersensitive sensation in the feet, particularly at night. This is a more advanced form of neuropathic pain where damaged nerve fibers begin firing abnormally and excessively. Patients describe it as a burning, electric, or deeply uncomfortable heat in the feet, sometimes so severe that even the weight of a bedsheet causes pain. This is called allodynia, a condition where stimuli that should not cause pain do cause pain because the nerve fibers responsible for pain signaling have become hyperactive. This symptom is often what finally brings patients to the doctor after months of ignoring milder symptoms, and it is a signal that nerve damage is no longer in its earliest stages. Warning sign number 3 is changes in skin color on the feet and lower legs. The skin may appear unusually pale or dusky, a grayish or yellowish tone that reflects reduced blood flow to the tissues. In darker skin tones, this may appear as an ashy discoloration. Some patients develop reddish-brown patches or areas of dark discoloration, particularly around the shins, a condition called diabetic dermopathy, sometimes called shin spots, which appears in up to 50% of people with long-standing diabetes, and is directly caused by changes in the small blood vessels of the skin. Warning sign number 4 is slow-healing cuts, blisters, or sores on the feet. This is one of the most medically serious warning signs on this list. In a healthy foot with normal circulation and normal nerve function, a small cut heals within days. In a foot affected by diabetic changes, the same wound may remain open for weeks. The reason is dual. Reduced blood flow means reduced delivery of oxygen, immune cells, and the growth factors that tissue repair requires. And reduced nerve function means the patient often cannot feel the wound properly and therefore does not protect it adequately. Slow-healing wounds on the feet in seniors are a medical emergency waiting to happen. They are the pathway to diabetic foot ulcers, open wounds that become chronically infected, and in severe cases to the tissue death and bone infection that leads to amputation. Diabetes is responsible for over 60% of non-traumatic lower limb amputations in the United States, and most of them began as a small wound that nobody took seriously soon enough. Warning sign number 5 is excessive dryness and cracking of the skin on the feet, particularly on the heels. Diabetic neuropathy affects not only the sensory and motor nerve fibers, but also the autonomic nerve fibers that control sweating. When these autonomic nerves are damaged, the sweat glands in the feet stop functioning properly. The skin becomes extremely dry, begins to crack, particularly at the heels, and loses its natural barrier function. These cracks become entry points for bacteria, creating the pathway to the infections and non-healing wounds I described in sign number 4. This is why diabetic foot care specifically emphasizes daily moisturizing of the feet, not for cosmetic reasons, but to maintain the skin barrier that protects against infection. Warning sign number 6 is changes in toenail appearance, specifically toenails that have become thicker, yellower, more brittle, or have developed a crumbly texture. Poor circulation to the nail bed changes how the nail grows. Reduced immune function at the extremities makes fungal nail infections, onychomycosis, far more common in diabetic patients than in the general population. And diabetic neuropathy can cause subtle changes in how weight is distributed across the foot, changing the mechanical stress on nail beds and altering nail growth patterns. Thickened, discolored toenails that have changed significantly in the last year or two are worth discussing with your doctor, particularly alongside any of the other signs I am describing. Warning sign number 7 is swelling of the feet and ankles that does not resolve with rest and elevation. While ankle swelling has many causes, heart failure, venous insufficiency, medication side effects, in the context of diabetes, it often reflects a combination of reduced lymphatic function, kidney changes, and the cardiovascular effects of long-standing blood sugar elevation. When swelling is persistent, present on most days, and accompanied by any other signs on this list, it becomes a more urgent signal that something systemic is wrong. Warning sign number 8 is muscle weakness or difficulty with balance when walking. Diabetic neuropathy eventually affects motor nerve fibers, the nerves that carry movement commands from the brain to the muscles of the feet and lower legs. The small intrinsic muscles of the foot begin to weaken. This causes subtle changes in how the foot moves and how weight is distributed during walking. Patients notice that they trip more easily, have less stability on uneven surfaces, and feel that their feet are not responding as predictably as they used to. This motor neuropathy also contributes to the development of foot deformities, including hammer toes and claw toes, that create abnormal pressure points and increase the risk of ulcer formation. Warning sign number 9 is cold feet that feel cold to the touch. Not just subjectively cold because of poor circulation, but objectively cold, where the skin temperature of the feet is measurably lower than the skin temperature of the lower leg. This reflects severe reduction in arterial blood flow to the foot, a condition called peripheral arterial disease, which is dramatically accelerated by diabetes. When the blood vessels supplying the feet become severely narrowed, less warm blood reaches the foot tissues and skin temperature drops. This is a late and serious sign that requires urgent medical evaluation. Now, I want to tell you about a patient who made me realize just how critical it is to talk about these 9 signs publicly. Her name was Dorothy. She was 69 years old when she first came to see me, not because she was worried about diabetes, but because her daughter had insisted she see a doctor about a sore on her right heel that had been there for 6 weeks and was not getting better. When I examined Dorothy's feet, I found 6 of the 9 warning signs I have just described. The non-healing heel wound, severe skin dryness and cracking, thickened discolored toenails, significant numbness when I tested sensation with a monofilament, a simple clinical tool used to assess nerve function in the feet, coolness on palpation suggesting reduced arterial flow, and subtle muscle wasting in the small muscles of the foot. Her fasting blood sugar came back at 241. Her HbA1c, a measure of average blood sugar over 3 months, was 9.2%. She had full advanced type 2 diabetes that had almost certainly been developing for at least 5 years. Dorothy told me she had noticed that her feet were dry and a bit numb for the past 2 years. She had bought a good moisturizer and figured it was just age. She had never connected it to diabetes. She had never been told to look at her feet as a warning system. The heel wound healed after 8 weeks of wound care. Dorothy is managing her diabetes now with medication and dietary changes, but the nerve damage she accumulated over those undiagnosed years is permanent. The numbness will not fully return. The arterial damage will require ongoing monitoring. She asked me at her last appointment, "Why did nobody ever tell me to check my feet?" I did not have a satisfying answer for her, which is exactly why I am telling you now. If you recognized any of the 9 warning signs I described today in your own feet, do not wait. Do not assume it is aging. Do not assume it is normal. Make an appointment with your doctor and ask specifically for a fasting blood glucose test and an HbA1c test. These are simple, inexpensive blood tests that can tell you within days whether diabetes or pre-diabetes is present. And if you have not been to the doctor in more than a year, go, because pre-diabetes caught early is reversible. Early-stage type 2 diabetes caught early can be managed so effectively that progression is slowed or stopped entirely. But neither of those outcomes is possible if the condition goes undetected. Take off your socks tonight. Look at your feet in good light. Run your finger across the skin. Check the nails. Check for any wounds or dark spots you have not noticed before. It takes 2 minutes, and it may be the 2 most important minutes of your health this year. If this video gave you information that you needed, please do 3 things right now. First, give this video a thumbs up. It takes 1 second, and it helps this channel reach more seniors who need this information before it is too late. Second, leave a comment below and tell me, did you recognize any of these 9 warning signs in your own feet today? I read every single comment on this channel, and I reply to as many as I can. And third, share this video. Share it with every person over 60 in your life. Share it with your siblings, your spouse, your friends, your neighbors, because the person who needs to see this most may never search for it on their own. You sharing it could genuinely save someone from an amputation, from kidney failure, from years of unmanaged disease. Subscribe to this channel if you are not already here, and hit the bell so you never miss a new video. I post every week. I am Dr. Michael Kent. Thank you for watching. Your feet have been trying to tell you something. Today, you finally know how to listen. I will see you in the next one.